The presenting health professional has made every attempt to protect the privacy of patients whose cases are discussed, and we ask that you respect that privacy. If you have a colleague that would be interested in viewing this video, please send a request with their email address to grandrounds@rocklifemed.org, and we will send them the link. Thank you.
All right, so we're letting people in now. The long-awaited May Lifestyle Medicine Grand Rounds, co-hosted by Rochester Lifestyle Medicine Institute and IHA in Michigan. So excited to have everybody coming to join us tonight. We have a very interesting case, and I'm very proud that we have Dr. Wayne Dysinger as our guest panelist and Jeffrey Pierce as our case presenter. And I will introduce our regular panelists shortly. At about 7:35, we're going to hear the case and have the panel discussion. At about 8:15, we're going to open it up for Q&A from the audience. At 8:30, we will officially end, as is our tradition, because that will be 1 hour in, and you will be deserving of an hour of CME. And within about 45 minutes or so, you will receive an email with a link to a survey. And once you fill that out, you will be sent a PDF of your with your certificate. And then typically at 8:30, we go into the lobby to continue discussing the case if people want to stick around. But tonight, we'd like to introduce you to our new Rochester Lifestyle Medicine Grand Rounds Forum. If you'd like to partner with us, you can to empower your patients. We have standardized programs to build motivation and competence in a socially supportive, interactive environment. If you look at the bottom there, we run 3 ACLM certified programs, the 15-day whole food plant-based jumpstart, the LIFT project with Darren Morton, and Pivio, the new version of the CHIP, the Complete Health Improvement Program. If you'd like more information about that, you can contact beth.garver@rocklifemed.org. Those a little bit of detail about those programs, which I won't go into now, but they'll be on the video. And then thanks to a generous donation, all of our CME courses are free to qualified medical professionals, including tonight's 1 CMA, but you get 10 CMEs for going through the LIFT project. You can get 10 CMEs for going through the Jumpstart, 15-day Jumpstart as well, plus an additional didactic material for 24, for a total of 24. And so we're excited to introduce our case presenter, Dr. Jeffrey Pierce. He's a board-certified family medicine physician in Northern California. Dr. Pierce attended medical school at Baylor, completed his residency in Santa Rosa Family Medicine residency, completed his fellowship in the Global Health Leadership at Contra Costa Regional Medical Center and Mass General Hospital, and he's board certified in lifestyle medicine. He specializes in weight management, diabetes, cardiovascular disease, hypertension, cholesterol management, fatty liver disease, cancer prevention, hormonal health, and healthy pregnancies, plant-based nutrition, autoimmune disorders, depression and anxiety, digestive health, and dementia prevention. He believes that with the right information and motivation, people can get to the root cause of their illness and heal themselves. He has interests including growing the majority of his family's fruits and vegetables, running, reading, and playing the saxophone in his jazz trio. And also, I believe it's not on here, but he is with formerly Plant-Based Telehealth, which is now known as Love.Life Telehealth. And Dr. Wayne Dysinger, former president of American College of Lifestyle Medicine, is a lifestyle preventive and family medicine physician, currently serving 2 main roles as physician and founder of Lifestyle Medicine, a new model group of primary care clinics, and is the chief medical officer for Healthly, developing collaboration of primary care practices in California. He's also the chair of the advisory board for the Lifestyle Medicine Global Alliance, and he's active faculty at Loma University. And consults, teaches, and participates in research on lifestyle medicine around the world. As I said, Dr. Dysinger is past president of the American College of Lifestyle Medicine and founding and past chair of both the American Board of Lifestyle Medicine and the International Board of Lifestyle Medicine. He has previously worked in various capacities with the AMA, the American College of Preventive Medicine, and the Association for Prevention, Teaching, and Research. Prior to his current position, Dr. Dysinger was chair of the Department of Preventive Medicine at Loma Linda, and faculty co-founder of both the family and the preventive medicine residencies at Dartmouth. He has also worked in faculty, patient care, and service capacities in Atlanta and Guam. Dr. Dysinger earned his medical degree from Loma Linda in 1986 and his MPH from Loma Linda in 1990. He is a fellow of the American College of Lifestyle Medicine, the American College of Preventive Medicine, and the American Academy of Family Physicians. So I'm so excited to have both Dr. Dysinger and Dr. Pierce. I'm also excited to have our regular panelists, Dr. Bob Breakey with IHA, and Melissa Sunderman, formerly of IHA, and now with the Canyon Ranch in Lenox, Massachusetts. And a little bit about our own staff here. Dr. Susan Friedman is our course wrangler. She makes sure that we have have people who can present courses, and she's a world famous geriatrician, and I'm just going to leave it at that. And that's me. I am board certified in lifestyle medicine and interventional radiology, and I'm the founder and president of RLMI. So immediately after this, we are going to go to onepaleblue.earth at 8:30. And now I'm going to turn it over to Dr. Pierce. Sorry I took so long on that, but I have a lot to say. So Dr. Pierce, welcome. Why don't you share your case?
Okay, I'm gonna go ahead and start sharing my screen. Okay, great. Well, first of all, thank you very much for giving me the chance to present this case. I love everything Rochester Life Medicine, and I've taken the big 24 CME course and participated in the 15-day Jumpstart. It's an excellent program. Most everybody on this call already knows that, and hopefully recommends that to their patients and clients because it is it's excellent, and it is funny, and it is also very well priced. And so it's a big pleasure to be here as part of that tonight.
Great.
All right. So
thank you very much.
Right on. Okay, so let's go ahead and get started with the case. This is lifestyle medicine in a case of localized breast cancer, a bit of a less common consultation for me. All right, so some objectives to get started. By the end of the discussion, we will be able to offer various ways to support a patient requesting a lifestyle medicine intervention for a condition maybe not typically treated with lifestyle medicine. Number two is that we're going to summarize key lifestyle medicine recommendations that may reduce risk of breast cancer and decrease breast cancer recurrence and mortality. And then we're going to list 10 factors held in common by radical remission patients in their relation to lifestyle medicine. And by the end of this talk, you'll know what I mean by a radical remission patient. Okay, so just a minute to start with where I'm living. I live in Northern California in Santa Rosa. This is, if you can see my pointer, I'm the bottom heart. Just coincidentally, it's kind of a nice place for lifestyle medicine. Over here at the top right is the Flamingo Resort and Hotel, where Dr. McDougall used to do his in-person retreats, and where my buddy Anthony Lim still runs the virtual retreats that the McDougall program does, and they do awesome work there. And then to the left of that is where Dr. Goldhammer and the rest of his crew do True North Health Center with their water fasts and other great work. And so I feel like I am amongst giants here in this little town. My practice is a telehealth practice for lifestyle medicine. It's part of Love.Life Telehealth. I'm proud to be part of that group. It's from my home office here in Santa Rosa. The typical patient mix, I think, for a lot of folks doing lifestyle medicine, seeing people who are working on weight loss, high cholesterol, blood pressure, diabetes, autoimmune disease, gut health, insomnia, healthy pregnancies, and some other women's health conditions. But we have a select group of folks, I think, that see us and practices like ours because they're self-pay. Granted, they can submit a super bill and hopefully get part or all of the visit paid for by their insurance, but they come realizing that this might be out of pocket. So this is not, say, the typical patient at my county practice who are there for different reasons and perhaps different motivation. And these are long appointments, also in contrast to some other practices where my shortest appointment is 30 minutes, and somehow that still feels too short. So we have 30 and 60-minute appointments. Okay, let's go ahead and get launched into the case. And so I'm very honored to be presenting about this case, and I have her permission. And our patient is a 61-year-old woman from rural Texas. She has a history of some chronic conditions, obesity, polycystic ovarian syndrome, gallstones, the thinning bones of osteoporosis, a couple of different kinds of non-melanoma skin cancers in the past, and some thyroid disease with a history of successfully treated breast cancer back in 2018. And we'll go a little bit more into that detail. And then she saw me for the first time presenting in March of 2022 with a recent diagnosis of a second breast cancer in the same breast, in the left breast there. So she received fairly traditional therapy in 2018. She had a lumpectomy, which is a sort of a segmental removal of part of the breast tissue that had the cancer in it. They did an evaluation of her lymph nodes, and there was no cancer in those nodes, and she ended up declining the recommended radiation. So a little bit truncated, but still underwent surgery and evaluation at that point. And for a number of years, everything was going great. But now she has this new diagnosis of a breast cancer in the same breast, and she decided that she wanted to wait to receive any more typical surgery, radiation, chemotherapy, and would like to try alternative methods first. And her goal was to beat cancer without surgery or radiation, though she'd be willing to try some of the more traditional things afterwards. So I have to say this threw me for a bit of a loop, because most of my patients, like I said earlier, are coming to me saying, hey, I'm off most of my diabetes meds. I just need a little bit of help with A, B, and C. But she was asking to try to cure her breast cancer. And that was a very memorable first encounter, and part of the reason why we're talking about this today. So I'm going to go back in time a little bit more, 2 months prior to January of 2022, to what I'm going to call visit 0. She saw another one of the great docs in the group, and at that time she was just planning on working on weight loss, bone density, and thyroid health. She said that she had struggled with weight and snacking issues and other sorts of health issues, and was eating what we call the standard American diet for many decades. But she said she was motivated to go plant-based and work on her weight and her bone density and thyroid health. She was 5'7" at the time, 219 pounds, with a BMI body mass index of 34. And as a reminder, 30 and greater is considered in the obese range. And she had just had an abnormal mammogram around the time of that first visit, and was getting a follow-up later that same day, back in January. And so a couple months passed, and I met her for the first time in March. And she said, you know what, 2 months ago, I had an abnormal mammogram. They followed it up, and it was a 7-millimeter cancerous lesion in the left breast. And they did a needle aspiration and found out that it was estrogen receptor positive invasive ductal carcinoma. Meaning, so it had receptors on the outside of the cells that were responsive to estrogen, and it was a cancer of the ducts of the breast. A CT scan done at the same time showed that the mass was in the upper outer quadrant of the left breast, which is a fairly common place to have a breast cancer. And based on just the CT scan, there wasn't any obvious axillary or sort of armpit area lymph nodes or otherwise noted, but she did not do any lymph node biopsying or anything at that point. She said, okay, thank you, Dr. Oncologist, but I want to try some other things. And her oncologist was very supportive and scheduled her for follow-up because she was going to try to work with somebody else perhaps to address the cancer. So I like to start probably like all of us when we're talking with our patients about lifestyle medicine approach to illness, to start with sort of a review of the 6 pillars of lifestyle medicine and see what she's already doing. So she said she had stopped all meat and dairy in 1 day after the diagnosis back in January, and started moving to a more whole food diet with fresh juices and less oil. And we'll get into more detail about this at the end of the talk about specifically what she was eating. I think she shared with me what that was so that folks who are more interested in the details can see that. For exercise, she was doing a combination of cardio and aerobic type exercise with weights, stationary bike, swimming, and a little bit of hiking, but it wasn't a major part of her week. She said sleep had not been a problem for her, getting about 7 hours a night. For stress, she had been using, because of course it was a stressful time for her and her family, but she'd been using breathing techniques. She is a member of the Church of Latter-day Saints and uses prayer, and also works on family tree, listens to audiobooks, and does jigsaw puzzles. So she had some things in place for dealing with stress at the time. And as far as relationship and community, she had a supportive family, supportive church, and with her work community as well. And then as far as the sixth pillar of lifestyle medicine, trying to avoid toxins, she does not smoke cigarettes and was not drinking alcohol at all at that point. So as far as past medical history, I mentioned most of these already: the polycystic ovarian syndrome, obesity, the previous breast cancer, osteoporosis, the skin cancers. She was in menopause and had thyroid disease. And the surgical history for the left breast cancer in 2018, a gallbladder removal, and the sort of local surgeries for her previous skin cancers. She was on a low dose of methimazole to control the hyperthyroid disease. And she was on sort of a limited number of supplements at that time. Some ORAC energy greens, some algae-based calcium and strontium, acai, garlic and turmeric, and some B12. Some history of hematemesis, of vomiting blood from ibuprofen when she used to take more, but no other medical allergies per se. And family history was pertinent that her mother had struggled with alcoholism and cigarette smoking in the past, which of course our patient was not doing, which was already a stroke in something in her favor. There was heart disease and cancer in her family. The only family member with breast cancer that she could recollect was a paternal great-grandmother with breast cancer. So she was like the majority. What is it? Somewhere like 80 or 90% of people with breast cancer do not have a first-degree family relative with breast cancer. And a father with dementia, what's referred to now as dementia with Lewy bodies, and COPD, osteoporosis, and stroke. So a fair amount of chronic disease in her family. Socially, she was married with a supportive husband, an adult daughter and a stepdaughter, and her cat, Precious, who's 14 years old. And for review of symptoms, she was asymptomatic at the time. She, at this meeting, my first meeting with her, but the second meeting in our group, she was down 20 pounds in the last 2 months from making her initial changes. So her BMI dropped from 34 to 31 based on the recommendations from that first meeting with our doc. And we didn't have much on labs back in November. Some cholesterol that was above the heart attack proof range, as Dr. Esselstyn likes to say. Her total cholesterol was 200, the good cholesterol 53, which is a good number for her. Her bad cholesterol, or LDL, was elevated at 121. Her triglycerides were borderline at 146. And her complete blood count, where we look at white blood cells, red blood cells, platelets, and the like, was totally normal. Okay, Bob, do you have the first question? Aha. So what would you do at this point? State that you cannot see her since she is going against the medical advice of her oncologist and there's no evidence that lifestyle medicine will help her. Tell her you will support her as best as possible and give her recommendations for what lifestyle medicine practice she can incorporate into her daily life that may help address her breast cancer diagnosis while also helping her other chronic illnesses. And then the third option is give her lifestyle medicine suggestions to help with weight loss and other chronic illnesses, but be specific that you cannot address her cancer concern because this is out of standard of care. I think I'll answer two. So 85%, the majority of the folks said that they will do their best to address her main concern, which is her breast cancer. And then about 15% say, hey, look, we've got a lot that we can do for your overweight, obesity, and sort of risk for things like heart disease and diabetes. But specifically, this is treating breast cancer with diet and exercise is not standard care. Cool. So thank you, everybody, for participating. And I certainly don't feel like there is a one right answer to these questions. It's more to get your thoughts. All right, we're going to continue. So what I recommended was that I reviewed standard of care for early breast cancer, typically involves surgery and radiation, and that she should continue her conversation with an oncologist and keep her follow-up appointments. I said that I wasn't aware of any, great high quality studies that everyone's talking about in lifestyle medicine about how to reverse breast cancer with diet and lifestyle. But I did say, based on what we know of preventing breast cancer and preventing recurrence and death following cancer diagnosis and treatment, here are some things that I would recommend that theoretically could help her as she is trying these things and keeping in contact with her oncologist. All right, so just my general approach for these things when I give recommendations to a patient, I am often checking up to date for the sort of more traditional medical approach. It has its benefits and downsides, UpToDate does, but it's a great place to find a lot of good information in general. I also go to the Physicians Committee for Responsible Medicine. They have an excellent nutrition guide for clinicians, and there's the link, and I'll show you a screenshot in a second of it. And you can just type in breast cancer or diabetes or whatever it is and see what they have compiled for the evidence. The main focus is on what diet can do for these conditions. It's a very excellent resource and it's free. And then, yeah.
So Jeffrey, at some point I want to go to our panel. Tell me if this is a good time.
I'll finish the slide and let's go to the panel.
Okay, great.
Okay, and there's a fact sheet, and I also refer to Dr. Christy Funk, who's a breast cancer surgeon and has the memorable title of her book, Breast, the Owner's Manual. I also often refer to Dr. Greger's nutrition facts page when searching for what the evidence shows. Okay, all yours, Ted.
Excellent. Wow. Great presentation. I'd like to hear what Dr. Dysinger has to say, please, our guest panelist.
Yeah, no, it's exciting for me to be in on this, and I believe you're going to go into some of the specifics of what these references go about. So, you know, when I will tell you a story. I have a 69-year-old patient, had a 69-year-old patient who showed up in my office with somewhat of a similar story. But this 69-year-old patient had more advanced breast cancer than it sounds like your patient did. And I tried to convince her to go to the traditional route. And she didn't. She chose not to. And she ended up dying at age 69 from breast cancer, which was a death that I don't think needed to happen. But you know, it's not my job to tell a patient what to do. It's just my job to try to present data. And she was very clear that's what she wanted to do. But to me, one of the things that highlights is the need for, and I was very gratified to see that 85% of the people here, well, actually 100% of the people here would continue to engage with this patient. And 85% would continue to engage around cancer, because I feel like one of the things we need is evidence-based, not only primary care doctors, but evidence-based surgeons and evidence-based oncologists who are willing to give options for patients, because right now patients feel like they don't have options, so they make these radical decisions of not even being open to even modifications around some of the traditional therapy that does actually work. The traditional therapy works, but I agree that there's a lot that lifestyle medicine. I'm not going to go into that now because I think you're going to go into that more, Dr. Pierce. But
that's great. Thank you, Dr. Dysinger. Before we go to Dr. Sunderman, I just want to ask Dr. Pierce, as a women's imager, I deal with this basically all day long. What was the cell type for the cancer? Do you remember?
So all the information she could give me was this estrogen receptor positive invasive ductal cell carcinoma.
Okay, invasive. Okay, right.
Yeah, I tried to clarify. Are you sure it wasn't carcinoma in situ? And she said, right. No, that phrase didn't sound familiar to her.
Okay, fair enough. Dr. Sunderman.
Thanks for sharing your input, Dr. Dysinger. And I'm sorry about your patient that was not the outcome that you wanted. So Dr. Pierce, I'm so happy that this patient found you and found plant-based telehealth, love.life. My only wish is that with her first cancer occurrence that she found you, because I know that you would have counseled her on how she could prevent recurrence, right? With reducing her BMI, with increasing soy, with doing berries, with getting physical activity. And I agree with Dr. Dysinger, we need more specialists. And I happen to have a couple of rock star close friends, Dr. Amy Commander, Dr. Amber Orman, and Dr. Dawn Masalem, who are all in breast cancer survivorship, oncology, radiation oncology, and they are doing this work, right? So if they have a patient who has been diagnosed with breast cancer, not only do they want them to thrive or survive, but they want them to thrive and reduce the risk of recurrence. So I think that I'm glad that she came to you, and she came under the auspice of wanting to lose weight, right? So sometimes it's like a diagnosis of breast cancer. It's not even on the radar that there's lifestyle changes that could help mitigate recurrence, but I want to lose weight. So I'm going to try to learn to do it a healthy way. But any way that she got in your door, I'm really grateful that she's under your hands and that you can guide her through this journey.
Dr. Brakey, and also Dr. Brakey, I wonder if you could just address the fact that I don't think the patient had radiation the first time around. Is that correct?
Correct.
Yeah.
Yeah, Jeff, I just want to echo that. Thank you for bringing this forward. Historically, as you implied, it's sort of taboo to talk about things that might interfere with someone getting appropriate standard care. As Dr. Dysinger mentioned, we have to be cautious about that. And as you also implied, and as our respondents mentioned, it really isn't an if, either or. It's an adjunct. It's a, hey, whatever else you're doing, this can help you. And I know you mentioned John McDougall. He's kind of famous for saying, well, everybody gets better. That doesn't mean everybody's cured, but it means that when you give people the right food, the right environment, the right sleep, the right their physiology works better. Their immune system is enhanced, their inflammation levels go down, their circulation improves. So from wherever they're at, they get better. So there's no downside to adding this to whatever else they're going to do. Now, in this case, it does provide an interesting case because it's always an individual's choice whether they're going to pursue a certain treatment or program or not. We can encourage, offer, advise, and then they make a choice. And in her case, she said, this is what I want to do. Help me with this. So you have a motivated patient with a confirmed serious diagnosis, and we're looking forward to seeing what unfolds in the rest of this case as you then help her to improve from wherever she's at by not alternative, but methods through lifestyle medicine that can complement whatever else she chooses to do. So thanks for bringing this forward.
Yeah, that's great. What about the idea that she didn't have radiation the first time? That doesn't. I can understand people not wanting chemotherapy, but I have a hard time understanding why somebody wouldn't want the radiation.
I know you're a radiation guy. Radiation also has its toxicity. And I know that we're seeing now, and maybe Jeff, you have a better answer to her in particular, but I do see a lot of patients like that say, I really want to enhance my own immune system, my ability. And at that point in her life, she was, she was up for the surgery, and now we see another extension for that. I'm not even doing lumpectomy. The first time I did it without the kind of adjuvant therapy of whatever. I'm going to do it from square one with this one. So, and again, I see a lot of people like that. They're attracted to us in lifestyle medicine, that they want to do things natural or holistically, but I don't know, maybe others have comments.
Sure. And I'll definitely, I'll speak to some of that as well. Bob, thank you very much too.
All right, proceed, please.
Yeah. I'll just make, let's see, one comment to Dr. Sonneman. She said, meeting her after the first cancer, thank you for saying that. The patient was very forthcoming, saying, yeah, I didn't change a single thing after the first cancer diagnosis, just had the surgery. And
probably she wasn't counseled in that, right? It was, yeah, it was, oh, you got the bad luck of the draw. So hopefully it won't happen again.
Right. Okay, so let's see what else came of this. And so here's a screenshot of PCRM's nutritional guide for clinicians. For those that don't know about it, it's excellent. Breast cancer, this is their fact sheet, and I'll summarize some of that. And then there's the Dr. Funk's book with the memorable cover. So I recommended, so I went over a lifestyle medicine, the 6 pillars, about sort of general recommendations for it, and kind of a special focus on the big 4 that PCRM likes to talk about for breast cancer is a plant-based diet, maintaining a healthy weight, getting good exercise, limiting alcohol. So for the diet, high fiber with a focus on all the foods that we know, eating the rainbow, low-fat foods. She had already switched off of meat and dairy. And then plenty of whole or minimally processed soy for the phytoestrogens that work in such a great way as compared to animal-based estrogens. It appears to be quite different. You know, I guess I didn't mention to her at the time, but also another way to think about that is Dr. Joel Fuhrman's G bombs for greens, beans, onion family, mushrooms, berries, and seeds and nuts for being really anti-cancer, anti-inflammatory type foods. For weight management, you know, and this is theoretically because of adipose tissue will convert androgens to estrogens, so you have more estrogen circulating in the system. The diet from having high fiber helps to flush out the estrogens by decreasing reuptake in the intestines. So a lot of this sort of revolves around estrogen. She'd already lost 20 pounds, and I suggested shooting for an ideal body weight. I don't often do that, or I don't always do that, but just, you know, I kind of felt some urgency if she was going to not do surgery, et cetera, on this. You know, I said, let's just start with 150 minutes per week of moderate exercise. But maybe I should have said, you know, 300 a week or 150 a vigorous, because maybe in the cancer literature, maybe there's more, certainly in general, more is better. Until you get to, you know, excessive amounts. Avoiding alcohol was easy for her because she was not drinking. There's some evidence that people with higher vitamin D levels do better when it comes to breast cancer. So I touched on that. And then I suggested some people, for those that don't know about Ruth Heydrich, who's pretty amazing. She had stage 4 cancer, had a double mastectomy, but didn't get other therapy, and was in a research study with Dr. McDougall, and then 2 years later was running the Ironman in Hawaii, which is a 2.4 mile swim and a 112 mile bike and 26 miles all on the same day without driving anywhere. And so she's got a great book, A Race for Life. Janet Mary Wakelin, who I think is maybe less known than Ruth, is a pretty amazing New Zealander who declined breast cancer therapy, but wanted to change her diet and try to do it more naturally, and reversed her breast cancer. And then she and her husband, a handful of years later, ran around Australia by doing a marathon every day for 366 days in a row. That might be more than I would recommend towards for my average patient, but that was pretty amazing for her. She was already a fan of Chris Wark from Chris Beat Cancer, who had colon cancer in the past, and referred to her to Dr. Funk's work. And, you know, I could have said just follow an Esselstyn or Ornish diet, because even though that is a heart disease diet, you know, we don't have a different diet for heart disease and breast cancer and diabetes. It's amazing how it all comes down to a common denominator of inflammation, it seems. Okay, so for her second visit, and the second, third visit are going to be much shorter than the first visit, don't worry. She was eating more soy, working on her diet, doing a little bit more exercise. She dropped a few more pounds. She was still having some issues with snacking and eating some roasted nuts and having trouble with prepping her meals. She started to take oral supplements of European mistletoe, wanted to know what I thought about it. Okay, question number 2, Bob. At this point, you would continue on the path with some minor changes. She's making progress, or push her much harder because she's not making changes fast enough, or stop all this craziness in the doctor-patient relationship because you're getting nervous. Okay, so most say a little bit narrower margin here, but most say continue on the same path with some minor changes. 40% say push her harder. In the doctor-patient relation group have already left the call, I think, and so none of 0% on that option there. Okay, so thanks everybody for participating. So my recommendations, I congratulated her on her progress, reviewed the pillars, told her to review the prior recommendations. We worked on keeping the crackers out of the house. Like Chef AJ says, if it's in your house, it's in your mouth. So try not to buy them. Switched to raw nuts over roasted, and worked on batch prep and working on how to get more soy in. I told her, hey, I'm not a naturopath. I don't or integrative doc, so I'm not your source for mistletoe, but I looked up something from Memorial Sloan Kettering, and it's used in Europe, but in an IV form, and they're doing some early studies on it, but I thought it wasn't ready for prime time. At least there were no interactions with methimazole, and for her just to be careful with it if she was taking it. And I ordered some basic labs at that point. Okay. So third visit a month later, in June, remember her first visit was in March. She had a repeat mammogram and it showed no growth. It also showed no shrinkage. So she was a little bit let down, but decided that she was going to keep going with her current plan. They had canceled the ultrasound, they said, I guess, because there wasn't any growth. Maybe it wasn't needed. That was per her recollection. And then what I didn't know at the time was that she had not followed up with her oncologist, that her oncologist had moved and she didn't want to meet the new doc. It was a hassle for her to travel from rural Texas to busy metropolitan area in Texas. And so she didn't tell me this, but she wasn't following up with her cancer doc at the moment. So I guess maybe a benefit of telehealth that she was at least seeing me. We worked on eating more soy. She was trying some different things to help with her diet. And she asked me about organic versus conventional. She started drinking something called Estiac tea. And she was exercising about 180 minutes per week. And she admitted that she could be doing more for her lifestyle medicine changes, though she had dropped some more pounds and she was now no longer in the obese range, 29.6 BMI, and her blood pressure was normal. Those labs didn't happen because she was having trouble getting the labs done. Okay. I congratulated her, told her to eat, she wanted to eat more raw veggies, drink more juices. I referred her to Dr. Goldner's green smoothie website, and it told her to please try to increase her exercise. And I recommended against the Estiac tea, but she decided to keep taking it. And I said, as far as organics, buy organic when you can, and look up the environmental working groups, Clean 15 and Dirty Dozen, to find out which are the foods that are the least and most contaminated with pesticides. And of course, to try to do some of her own food gardening, because that's the best way to get the tastiest, healthiest food in the world. And I told her to keep close contact with me and her oncologist at that point.
So Jeffrey, I would love to hear what our panelists have to say about, especially with that survey that you put out there.
Okay.
Dr. Dysinger, would you have continued on with this patient, or would you?
So yeah, I would have definitely continued on. I would have probably tried to get relatively more aggressive. A couple of things that I would have considered, or three things I would have considered. One is, so there's something called Gerson therapy, Gerson, Gerson, and I don't know if you're familiar with that. It's never really proved itself out from clinical trials, but it's something the National Cancer Institute has vetted and has not completely shot down. And it's an aggressive way of getting in higher antioxidant. Diet is really pushing vegetables and doing that in a way that smoothies and those kind of things. So when I have a cancer patient, that's one of the times. I'm not generally a huge fan of smoothies, but I think a cancer patient, that high antioxidant load is natural. So, a blended vegetable or a smoothie kind of vegetable thing, I think actually there's potentially a place for that. Gerson goes into other things like coffee enemas and other things that I'm not ever been convinced that there's value in that, but that high dose vegetable or high antioxidant load, to me, that's a useful thing. Another resource that I like, and this is more of a preliminary resource, but there's a book called Anti-Cancer by David Servin Sherber, I think is his name. He's someone he was a PhD researcher who actually ended up dying from brain cancer, but he wrote this book between his initial diagnosis and during sort of a remission before his cancer came back. And I find that a great resource as far as helping patients sort of review the terrain. He talks about how we all have cancer, but we can beat cancer if our terrain, if our immune system is strong and we're in an anti-inflammatory state. And then the final thing that I say, and I don't know if you talked about this at all with your patient, Dr. Pierce, but I start with my cancer patients, I start getting into the details around organic and toxins, getting plastics out and, looking at your your cleaning products and all those kinds of things. I think really getting aggressive with the toxins so the body can focus purely on the cancer and doesn't need to be fighting off other toxins. So those are some of the other things that I think about as I'm working. So to me, I would have gotten more aggressive into a few of those other areas. And obviously what you did worked. So that's wonderful. But
yeah.
So those are some of my thoughts.
Thank you for that, Dr. Dysinger. Dr. Sunderman, what are your thoughts?
So I echo everything that Dr. Dysinger said. And then, I think that when we look at this individual, she made some radical changes right away. When you said that she went overnight, gave up meat and dairy. So I think we want to find the balance where we don't lose her, right? Because she's made so much progress. Now you can present it and say, well, in order to get the best chance of success, we really want you to go all in. However, we don't want her to say, like, I can't do this, it's too overwhelming. And I love the analogy of like two ladders next to each other. And one ladder has about 30 rungs and the other ladder has only 4 rungs. Now they get to the same place, and it's just like, can you make small incremental steps and sustainable and keep climbing that ladder versus just some of those rungs are just too far apart and it's just too much of a stretch and I can't make it. So she's making great progress. I think emphasizing and giving her tools about, okay, here's your struggles. You're giving her tools, just like the Chef AJ tool, really focusing on what she can do more of, right? We always focus on what you can do more of and try to not focusing on what you can't do or can't have. So really focusing on those berries, all the antioxidants, and that she can even do frozen berries because that sometimes is a lot easier and sometimes can be more affordable, and the cruciferous vegetables, leafy greens, all the soy. So I think that she's your patient, so you can kind of, figure out like, am I pushing her away or is she still like, okay, I'm all in, and you want to support her with that. And I think also you touched on, sort of stress level, and it sounds like from a surface area, like a surface look, that she's doing okay with stress, but I did notice in her family history that her mom was alcoholic. And so, and I think it's, exploring that if it's comfortable about adverse, childhood events, because we know that increased stress can, affect the immune system and maybe at a higher risk. So just exploring that stress in her life a little bit. And then as Dr. Outdoors, I am going to say to add on getting outdoors, we know that spending time in nature does help with Dr. Kingley early on with boosting our natural killer cell activity. So trying to get that dose of nature, I'd say 20 minutes per day would be my recommendation.
That's great. Thank you, Dr. Sunderman. I just want to say that we're going to, let's not rush this case because I think we're doing well here. And I know it's 8:15, but we got time. So Dr. Brakey.
The real challenge of lifestyle medicine is how do we inspire internal motivation? Obviously, the what to do is pretty easy, and you've laid that out for her, given your many resources. And like Dr. Dysinger, I would encourage her to get more aggressive with respect to the processed foods, the crackers, the weight loss goals, the things she's doing. For the main reasons, and try to explore this with her, are that, yes, it is a serious diagnosis. I mean, this isn't something you can just kind of tiptoe around the edges with. And secondly, she has a strong will to live, a reason. She loves her life, her family, her church, her things that she's contributing to the world. So try to see where and how you can marry that. Boy, this is serious, good thing you've made it this far, with what is your goals are. And whatever you choose is okay. I don't like to push. I don't want to tell her what to do. As Melissa says, we don't want to lose her. But at the same time, be able to say, there are some additional things that could help you put the odds in your favor. This mammogram showing lack of growth is good, but not great. It didn't show regression yet, and that's your goal. So what can you do in addition to what you're currently doing? And in her case, the crackers are an opportunity cost for foods that are probably lower in salt, oil, and refined carbs, and higher in fiber, phytonutrients, antioxidants, and anti-inflammatory components that really will help to put out the cancer, to literally suppress it. And as Dean Ornish showed in his prostate cancer reversal study, we can regulate genes too, partly through the microbiome and partly through direct effects of those phytonutrients on the genes to upregulate those that are cancer suppressors and downregulate those that allow the cancer to have angiogenesis, to grow, to mutate, to spread. So helping her to understand that the importance of, at this point, okay, you've made it this far, but time to double down. And making it her idea to do so is her challenge. But boy, you're doing great so far. We're looking forward to the rest.
Yeah, I'm on the edge of my seat. Yeah,
Okay.
continue, please.
Thanks, everybody. Yep. And I definitely want to be respectful for leaving times for Q&A from the audience. So I'm going to not spend too much time here, but let's wrap it up. So 6 months later, she's on my mind. I'm thinking, why haven't I seen her? Has it been financial? Has she been busy? Does she have bad news and she doesn't want to share it with me? But about the same time I was thinking about her, literally within a couple of days, I got an email from her at the end of December, and it said, "Good morning, wanted to share the good news with you. I had my 1-year mammogram yesterday, and I'm cancer free." The mammogram was completely negative. All right. So what do we say? Based on our news, your response would be, congratulations, this is exactly what I knew would happen. Let's do away with the field of oncology. Congratulations, spontaneous remissions do happen, though it was purely chance and had nothing to do with your lifestyle changes. Maybe you never really had cancer in the first place. Or congratulations, that's amazing. Keep up the diet and the other changes. Get that mammogram reviewed by your oncologist. Make sure it was an accurate reading. I know these aren't very fair questions, perhaps.
Well, those are great questions. I want to hear what the panel has to say about those questions before we move on.
Okay.
How are we doing, Bob? Oh, there we go. 100%. Congratulations. That's great.
Leading
Dr.
question.
Dysinger, what's your reaction to that?
No, I'm taking part in the poll too, so I was part of that 100%.
Okay.
So I obviously I do believe that life makes a difference, and as her doctor, Dr. Pierce, how gratifying is that, to know that you help cure someone from cancer. And I'll just share, I have a personal journey with cancer too. I have a 13-year-old son that died from cancer. And so cancer is something that I think is important to put into the lifestyle medicine realm more so than we do, so I'm thrilled to be part of this panel and to have cancer in the discussion here. We clearly need more data. I think with breast cancer, I shared my patient. It's really dangerous to not take advantage of some of the traditional things that we know work. The radiation, the surgery, radiation, chemo. But in a very early cancer like this, I think this is one case, obviously, but I think it proves that you don't have to rule out a lifestyle only. And I know you're going to talk about the Radical Remissions book, which is a great book. I love that book. So anyways, too long of an answer, but
yeah.
Suffice to say,
So Ted, I just wanted to, are you done, Dr. Dysinger?
Thank
Okay,
you, Dr.
so I was just
Dysinger.
going to say that I was just chatting with my friend and colleague, Dr. Amy Commander, who is breast oncology at Mass General. And she just forwarded this paper to me. It just came out May 4th, 2023 from JAMA Oncology, and it's adherence to cancer prevention lifestyle recommendations before, during, and 2 years after treatment for high-risk breast cancer. And so this just came out. It's perfect for this case. So I'm just going to read one sentence. Strong adherence to cancer prevention lifestyle recommendations, which is a dietary pattern rich in fruits and vegetables, non-smoking, physical activity, was associated with a 58% reduction in mortality and a 37% reduction in disease recurrence. So that's just came out in JAMA Oncology. So hopefully lifestyle modifications will become standard of care.
Great. Thank you. Dr. Brakey.
Back in the 60s, after the Surgeon General's report about smoking and health, there was still a lot of debate about whether this was real, whether we should be talking about it because it might delay treatment for lung cancer that might otherwise be life-saving, and on and on. We're at that point now where there still is naysayers and doubt out there, but in the reality, there is overwhelming evidence that the microenvironment that happens within the bodies, within the tissues and the cells, is either pro-cancer promoting or has the potential to be the opposite, to enhance the immune system function. So much like infectious disease, with an enhanced immune system, it has a much better chance of recognizing and taking out and creating apoptosis for these cancer cells. And we know now that animal protein, for example, stimulates IGF-1, which is a cancer promoter, that the heterocyclic amines that come from grilled and fried foods are both promoters and promote the spread of cancer. We know now that the processed foods are, again, that main opportunity cost I mentioned. So it's time to not be shy about it. None of us, I think, would go, like number one here said, do away with what else there is. This is an adjunct, but it's time to begin to really let people know, as Melissa said, this article now, the World Health Organization classifying processed meats as class 1 carcinogens. How much more evidence do we need to begin to tell people, look, this is important, just like preventing or treating smoking or emphysema or lung cancer? We would say step 1 is quit smoking. We need to help people to say, look, make your blood into a cancer fighting machine instead of the promoter that got you where you are now. So I think it's time to tell it the way it is.
Yeah, thank you, panelists, for the great discussion. Jeffrey, I'm just going to jump in for a second. I've been waiting for this chance as a diagnostic imager. I would like to say that I have trouble believing the mammogram. I would have much more faith in an ultrasound. In fact, if I were following this lady, since she had an ultrasound guided biopsy to begin with, I would follow it with ultrasound, right? Which doesn't involve any ionizing radiation. So you would think she would like that better, right? And if it really was disappearing by ultrasound, then I would be thrilled. But depending on how dense her breasts are, I'm not sure how easy it is to see this lesion mammographically. So I would not, based on that alone, say that she's cured. So
totally, yeah, and I definitely want her to follow up with her doc, and I will make that recommendation about the ultrasound as well.
Yeah, I think if I were her, I would have an ultrasound every 3 months, no radiation, and
And Dr. Dysinger, thank you for sharing that about your son, and the rest of your comments as well as the rest of the panel. Thank you. I am going to speed through these last ones here. Basically, I'm not recommending to stop traditional cancer therapy, but what can we do in addition? And then this is something that we might have some control over. Radical remissions or spontaneous remissions are fascinating. We should learn more about them. There is good evidence for prevention, primary prevention, but we need more about treatment. We do have evidence with prostate cancer for treatment, as Dr. Dean Ornish's work has done, and that's already been mentioned, and so the references are there. And Radical Remissions is a book where Dr. Turner looked at 1,500 cases in the literature of people who radically got better with their cancer and tried to find what they had in common. So not saying that if you followed these 10 things that they did, you would also cure your cancer, but what 10 things did they have in common? And it came down to a lot of the things that the lifestyle medicine and Rochester wheel points out: healthier diet, exercise, social support, spiritual connection, better emotions, or increasing positive emotions, strong reason to live, etc. So I here for reference will be what she changed in her words, and that is in some next steps for her. And that is it. I think we met our objectives, and thank you very much.
Wow, sorry you had to go through those last slides so quickly, but that was a great case, Jeff. I really appreciate it. And I know we have a lot of audience interest. So who in the audience would like to raise your hand. Looks like Jill Brooks has her hand up. Yes. Go ahead, Jill.
Hi, and thank you. What recommendations would you have for language? Because when most people bring up soy, they always have misconceptions. So what's your quick go-to, this is why they're wrong?
I can speak on that, but of course, anyone else from the panel, if you'd like to. So this negative information with soy seemed to be mostly out of mice and rat models from decades ago, and much more recently, we have a number of studies that show in humans that soy appears to be protective. And particularly when you're talking about minimally processed soy, and while it acts a lot like an aromatase inhibitor, it acts like a drug that oncologists are recommending, to where it binds to the beta estrogen receptor instead of the alpha, and it seems to be able to smartly sort of turn down cancer instead of promote it. That's kind of my capsule summary on that.
And then I just add, there's a difference between phytoestrogens and endogenous estrogens, and just explain what phyto means, plant. So really break it down from that standpoint too, and then what Jeff says as well.
Thank you.
Good question, thank you.
Anybody else from the audience have questions? Either raise your hand or unmute yourself.
Sorry about that. I have a great Wi-Fi connection, but apparently not a good internet connection. So I just got my wife to sign off. Ah, Deb Kluger, how's it going, Dr. Kluger?
Pretty good. Pretty good. Pretty good.
What's your question?
My question, I guess, is, and we touched on a little bit, was some of the background, the family history, as well as I think Dr. Sunderman mentioned ACEs, adverse childhood experiences, and possibly trauma in the past, things that cause us to have inflammation, have unhealthy processes going on in the body. I noticed she had a history of also having polycystic ovarian syndrome. There's some other factors that are in her history that cause some different things and may have predisposed her to more cancer forming cells in her body. So I don't know how heavily that pillar or that was actually looked into. But one thing I've seen, and I've seen it repeatedly, is it seems like that background history is an important piece that sometimes we just ask, did your mom or dad have this, that, or the other thing, but we really don't get into that part. And I've seen recurrent patterns with people that have these experiences or some of these things in their past, that it's showing up later on with some of these manifesting in some of these other disease processes.
And she also said that her stepchild has special needs. So even though that might be status quo and just her life, you know, it might be to anyone else really, really stressful, but she's like, oh yeah, that's just, you know, I'm just used to it, or that's just my life. So, you know, just pointing those out, that this could, you know, have a role in this, and not that you have a choice in that matter, right? You didn't choose what your mom struggled with, or that you have a stepchild with, but just validating that stress is there, or could be there.
I think part of this, as you implied, is that additional collateral damage on the other pillars. When someone's stressed, they don't sleep well, that they make poor food choice decisions, they don't have time to exercise, they withdraw and don't make social connections even more because they're too stressed to interact. So I think you're right, kind of delving into what motivates you, what would help you to get over some of that and move forward instead of looking back, can be helpful, because it then sets them up for doing better on the other parts too. And then that has a positive upward loop of the brain actually functions better when you're letting it sleep, when you're exercising, when you're eating right. So yes, thank you for bringing that up. It's an important piece that can't be changed what happened, but it can be changed how you relate to it, how you react to it, how you move forward from there.
Yeah, so I appreciate you highlighting that, Dr. Kluger. And you know, the functional medicine world has something called the functional medicine matrix, and it's a way of assessing a patient. And in that, they have the lifestyle medicine pillar sort of on the bottom of it, which I think is great. But they use a couple words that I think we would be wise to use more in the lifestyle medicine world. One is antecedents, and antecedents is basically it's ACEs, it's anything that sort of predisposes someone to disease. And I don't know how much that directly affects this one particular case. Maybe not. I don't know. But I think in a case presentation like this, it would be fun to go over things like antecedents. The other word that they use is triggers. So it's one thing to have an antecedent, something that predisposes you. It's another thing to have something that kicks that off. And we all know that as we go through life, little things, sometimes very little things, will take us down a rabbit hole, either emotionally or physically. And so I like the idea of digging deeper. And again, maybe not this particular case so much, but as a general rule, as we get to know our patients, I think understanding their antecedents, understanding their triggers is a very valuable concept to have as part of how we get to know our patients better.
Yeah. Great. Well, listen, it's a little bit past 8:30. It's 8:34, and I promised we'd try to end on time around 8:30. So we are going to officially adjourn this meeting. And people who have been here will receive an email in about 45 minutes to an hour with a link so they can download their certificate. And I'm going to just make a couple of announcements. Well, actually not. I'm going to just thank Dr. Pierce because you did the hard work, the heavy lifting today. We get to just listen from the sidelines but I'm very excited for the panelists. I thought they gave incredible insights. Dr. Dysinger, Dr. Sunderman, Dr. Brakey, you were brilliant as always. And let me just share my screen here for a second and make sure that's on. And so that was our case. We do have some information sessions coming up about our lifestyle medicine programs. We like to think of ourselves as a one-stop shopping for doctors anywhere in the country who have a patient who might benefit from one of these programs. All you have to do is go to our website and you can fill out a referral form, and we will contact the patient and get them enrolled in whichever program you desire. Plus, we also have health coaching, which is not on this list, but if you have a patient who needs a health coach, we also can provide that. You can follow us at rocklifemed. And we'd love it if you'd stick around and join us for a special introduction to our brand new forum, onepaleblue.earth. And with that, I'm officially adjourning this, but we'd love it if you'd stick around. So thank you all very much. And if you want to stick around, I got a little video to share, and we're going to show you this new platform we've developed. So let's see, we have 38 people here and still have 38 people. Okay, great. So let me share this video, which I have prepared, and let's see if it works. What if there were a social media platform where people of goodwill could come together and pursue the common good, learn from each other, have civil exchanges, and share the task of preserving human and planetary health? What if it sustained itself with a modest membership fee without advertising or algorithms? Introducing onepaleblue.earth, or One Pale Blue Dot, a program of Rochester Lifestyle Medicine Institute. One Pale Blue Dot is a place to make friends and have respectful conversations. With the increasing polarization of society and the erosion of trust in traditional sources of information, we live in an environment in which disinformation and hostility can spread. In the long run, few people will benefit from this environment. In the short run, many people and organizations find the current environment to be profitable. One Pale Blue Dot was created to help people communicate and connect in a positive way. One Pale Blue Dot is free of advertisements and corporate influence. This protection from conflict of interest is integral to our mission. Why is it called One Pale Blue Dot? The pale blue dot is an image of Earth taken from approximately 6 billion kilometers away by NASA's Voyager 1 spacecraft on February 14, 1990. In 1990, Carl Sagan, an astronomer on the Voyager imaging team, suggested that they turn the camera on the spacecraft toward Earth for one last photo. This is that photo. And you are here. The following is from Pale Blue Dot by Carl Sagan, published in 1994. There is perhaps no better demonstration of the folly of human conceits than this distant image of our tiny world. It underscores our responsibility to deal more kindly with one another and to preserve and cherish the pale blue dot, the only home we've ever known. Please join One Pale Blue Dot today. The only home we've ever known needs you.
You're muted.
We don't hear you.
All right. Sorry. Thank you all for watching that. Thank you. Jeez. Yeah, I had my microphone turned off. Yeah, thank you all for watching that. I really appreciate it. It's a labor of love. We started this project just about a year ago, and finally ready to kind of to launch it. And I just want to make it clear that this is going to be supported by user fees, but very small user fees. So $5 a month is all we think we're going to need to keep it running. Are we assuming we have enough people sign up? So I'm going to ask Bob Franke to share his screen and show you what the site looks like. And I need to make my screen a little bit bigger. So this is our homepage. And welcome to One Pale Blue Dot Earth, promoting human and planetary health through plant-based nutrition, kindness, and mutual respect. And I'll just read my message. Welcome to One Pale Blue Dot Earth, a social media platform designed to promote human and planetary health without paid advertisements. Our aim is to create a space that fosters meaningful connections, authentic conversations, and positive emotions. Rather than being supported by advertisers, where your attention is being sold to the highest bidder, this social media platform will be supported by a user fee of $5 per month. We're beginning this journey with medical professionals who believe in the power of lifestyle medicine to help heal people and the planet. Soon we will invite people with other interests and expertise who share the same goals. My team and I are excited to welcome you to One Pale Blue Dot Earth, and we look forward to building a community that reflects the best of what social media can offer. Please join us in helping to create a healthier world with compassion and joy. And I just want you to know that the first function of this platform will be to carry on these conversations about lifestyle medicine and grand rounds, to continue the conversations about how best to take care of our patients. So Bob, if you want to go into how the groups work, we've got a,
Sure.
we have groups under the lifestyle medicine grand rounds category. So also Deb Chiali is also going to help introduce some of these things. And I forget the order we decided on, Bob. Are we going to just show them around first, or we're going to show them around first?
Yeah, I thought basically, you know, what you're looking at here is somewhat familiar. This is a social media platform, and it has a lot of similar functionality to Facebook, except you know, for what we're producing here, the cost would be $5 a month, as opposed to the cost of Facebook, which is privacy and invasive ads and you know, tracking and so many things that basically keep people from sharing. And you know, we really want to be able to share and take the kinds of events that we're holding, like the grand rounds or our lifestyle as medicine lectures, and continue the discussion afterwards. But we want this to really be a fantastic value for people too. And right now, and everything that we're looking at here is kind of like the tour of the house with the frame and maybe some plumbing and electrical
installed. We have some concepts, but we're also looking for ideas and collaborators. So when a person becomes a member, they can have access to different types of groups, and all of these selections are groups. And the first type that I would show are types that can go to the public. Anybody can just basically join as an individual. And we've started off with 3 topics, and we're looking for more topics, but from nature photography to Mrs. Vegan, those people probably, many people here know Carol Barnett, Mrs. Vegan, Ted's wife, and then a generic whole food plant-based recipes category. But what's nice about this, and I think even a better level of functionality than Facebook, is as opposed to, now basically you've got a feed here, which is what groups look like when you're in Facebook. So whatever happens, it just gets pushed down, and you have to just keep scrolling to see what happened. Well, they've got a nice menu up here where you can go into discussions and actually set up topics. So we can have different topics, and but I wasn't going to show the discussions in this one. I was going to show the photos. So let me go over to the photos for this one. And members can be posting their photos, and then, you can of course go into them like a typical kind of a photo. And you can see who's contributed to them. And so this is just, the kind of album that you would expect for photos, but I will show discussions in another group. So I'm going to go back to the groups, and I'm going to now select the professional groups, and I'm going to turn it over in a few minutes to Deborah to go into some more detail about these. But in summary, these are basically some of the collaborations that we've already established with people in the medical professional community. And it's really exciting to have this place for being able to share people's work and information. But just to finish what Dr. Barnett was talking about earlier, we are going to build a group consisting of grand rounds events, and we basically just kind of got the keys to this and have been starting to populate it. But this will be the top level, so all lifestyle medicine grand rounds, and then within it there will be subgroups, one for each of the grand rounds that we conduct. So we've probably been doing this going on 2 years now, and we've had these very enriching events. They're live. We have the dialogue, discussion, questions in the chat. We have posted the videos in a YouTube channel. And then the discussion kind of stops there. And what we are envisioning is a situation where we could come in and have to begin with, the slides available. And I think I have a couple of things posted in the discussions here. Yes, so we would have the case slides available, and then after a day or so, we would upload the recording with the transcript and the log of the chat, and then be able to enter post-event conversations. So whatever people would want to continue discussing, they would be invited to participate, and even bringing in new topics. So if as a result of a conversation, there was a desire to actually start a whole new thread, then you could just start one here, and continue the dialogue there. And what's nice about this is, again, because each topic gets its own top level, everything doesn't just keep getting pushed down to the bottom. So we're looking at having a great repository for all of our past grand rounds. Over the next few weeks, we're going to be loading in all of the past videos and chat logs and case slides and things like that. And so people can join and they can watch the videos, or they can pick up in a conversation and be able to continue from there. So what I'd like to do now is just back up to the professional groups and turn this over to our own nurse practitioner, Deb Chieli.
So-
Thank you, Bob. We have so many exciting things just beginning. And while we have that slide up, one example that we can share, if we click on then the Nature as Medicine, Bob, then we can share. And Melissa Sunderman, Dr. Sunderman is helping us with this. I'm honored to be engaged with a subcommittee, Nature as Medicine, with Dr. Sunderman and Susie Spell and myself. And so what we've done in here is have a banner, and then we've added some documents that have links, and it's going to build a repository for people for research, for references, articles, and there are so many amazing resources out there. So that's one way that we can partner together to help build this, and a great example as a partner, and just a work in progress. So, and starting albums and discussions. And so that would be the same for all of these. We just got these up and running. Really want to talk around the topic of clinicians and climate solutions. Part of it's really being in the solution. So we have some discussions there and some research. And so we're excited to get the conversation going. I know we're getting short on time, so I wanted to see if we could share one part of our meeting that we shared once before. It's about 2 minutes, but it summed up and has an ask in it. And it summed up a little bit about what we're about, in addition to the Carl Sagan quote and Dr. Veggie's beautiful words there. So this is from Wendell Berry's The Dream of the Earth. Tell me a story that will be my story, as well as the story of everyone and everything about me. The story that brings us together in a valley community, a story that brings us together the human community with every living being in the valley, a story that brings us together under the arc of the great blue sky in the day and the starry heavens at night, a story that will drench us with rain and dry us in the wind, a story told by humans to one another that will also be the story that the wood thrush sings in the thicket, the story that the river recites in its downward journey, the story that the Storm King Mountain images forth in the fullness of its grandeur. We must, however, reflect on what is happening. It is an urgent matter. Something is happening to splendid and intimate modes of divine presence, and perhaps to ourselves. Welcome to onepaleblue.earth, and thank you for coming. We have created this space to hear, share, amplify, and connect the stories and dreams of each of us, the dreams of the people of the earth and all the beings who share it with us. This project is a hope and a dream of connecting with oneself and with one another, connecting with our patients and with our peers, connecting with those we do not know yet, connecting with the earth. We are here to provide a space to dream and create, to play and share, to give birth to and nurture ideas and solutions. Please bring your eyes, ears, and heart to this tour of onepaleblue.earth. And then we ask that you please share from the heart I'm sorry, share from the heart your first and second impressions, what you take away, what you need, what you would like to see in order to make part of your home with onepaleblue.earth. Welcome to onepaleblue.earth, a positive alternative media platform focused on human and planetary health. So thank you so much for being here. And we would ask that you consider joining. And we're attempting to create a place to foster conversation, solution-oriented, putting forth seminal articles. We already posted that JAMA article in the one for the case today, that amazing cancer article, making them accessible and organized, creating community, being inspired, and letting all of our members also know about important, relevant events. So thank you.
Deborah, thank you for that. That was a beautiful statement. I'm really touched. And I'm so honored to be working with my team and everybody on the screen. There's a lot of kind of not fuzzy reasons why we're doing this. I mean, there's a bunch of fuzzy reasons we're doing this, but one thing is when we started doing, when we formed back in 2015, when we were doing CHIP programs, we used to use private Facebook groups. And at that time, only about a third of people refused to go onto Facebook. Now it's more like half will refuse. So we just use our own Google Classrooms instead of the Facebook groups. But we found that there are people who would refuse to go on Facebook who would actually be willing to join this. So we're hoping that that alone will be a reason for
I think he was going to say that
so exciting. There's not going to be any advertising, right? So anyway, did I freeze there?
You did, yeah, you did freeze for about 30 seconds there.
Oh,
but,
no.
Yeah, but I think people got the idea that basically this is going to be a private, safe and supportive space, and we would love to, I guess we're saying, have you live part of your life with us, build part of your house with us. We are looking at those 4 groups that Deborah put up, and the fact that we are collaborating with medical professionals. We'd like to try to curate these spaces to educate and to get some work done. So in the email that's going to go around in a little while, besides giving you the opportunity to get the 1 CME, there'll just be a line in there asking if you would like to work with us on ideas and development and collaboration. And if you would, just reply to it and say, yes, I would like to participate, and we'll reach out to you, because we really appreciate this group and the potential for what it can do.
That's great. Thank you, Bob. Can you guys hear me?
Yes.
Yeah, okay. So are we asking people to sign up now, or are we holding off a little bit?
We're asking for people to let us know that they want to help us develop.
Okay. So, right. So we're not looking for general members yet, although it is possible, but just kind of hold off for maybe a few more weeks. So anyway, great.
Well, that process certainly, can involve, an account, but we're, I think, I mean, of course you are the boss, so you can make whatever rules you want, but yeah, my notion of what we were doing is we're trying to basically, get some inspiration and help, on building this, because, when we just open it up for people to come, we would really like to have a nice solid infrastructure in place.
Agreed. Does anybody have any questions or thoughts for us before we sign off? Great. Listen, thank you all so much for sticking around and for hearing us out. We're very excited about this. And hey, listen,
So far,
if we
so
don't,
good.
who will, right? So Anyway, all right.
Yeah, it didn't crash.
It didn't exactly. Exactly. All right. Good night, everybody. Thanks for coming.
Night.
All right. See you soon. All right.
Looking
Take care.
good, looking good.
Thanks.
Thanks,
Bye-bye.
Thank
Jack.
you.
Good
Bye.
night.
Thanks again, panel.
Bye.
Bye.
Bye. So far, so good.